This is Dr. Brian Castline with Brighton Foot and Ankle, and I wanted to share a story that we've heard too much in the clinic this week. We've had too many people come in this week complaining of heel pain, pain on the bottom portion of the heel. First couple steps out of bed in the morning, after they've been at rest or in a chair for a little bit and they go to get up off the chair, they complain of sharp stabbing pain into the bottom portion of the heel. Many times this makes them walk on the outside portion of the foot to take pressure off of that inside portion of the heel. And we call that plantar fasciitis. That's inflammation of the plantar fascia down through here on the bottom portion of the foot. This is something that we see very commonly. But in this last week, we had a lot of people come in complaining of plantar fasciitis pain down here on the bottom, but they are also complaining about Achilles tendon pain and calf muscle spasms. And it's interesting for these people to see that both problems come from the same source. We're gonna blame the calf muscles. We're gonna blame these two big strong muscles on the back portion of your leg called your gastrocnemius muscle and your soleus muscle. These two muscles come together to form that Achilles tendon. Two muscles again coming together to form that Achilles tendon, and that tendon attaches into the back portion of the heel. And when these muscles fire, they're gonna cause your foot to plantar flex or push down. And this helps propulse and move ourselves forward. But what can happen is when we have spasmings of the muscle, when we have really tight calf muscles, well, now we're gonna tug and pull harder on this Achilles tendon. We're not gonna allow the foot to come up, to dorsal flex, to operate against those muscles, which is actually really important. In our normal walking cycle, when you're on flat ground, and I always like to say in your kitchen, so when you're walking around your kitchen, we need that foot to not only come to 90 degrees to your leg like I'm showing now, we actually need that to come to plus 10. That's when we're pushing off our foot and we're moving ourselves forward. And if we have these tight, strong calf muscles and this tight Achilles tendon and it's tugging and pulling down here, well, it's gonna hold this foot in a downward position and not allow the foot to come up like this. What that does is that puts tremendous pressure onto the front portion of your foot, and it overworks this structure called your plantar fascia. I typically like to call the plantar fascia like a bowstring on a wooden bow and arrow, where the wood portion of the bow is the bone structure, and this bowstring is this plantar fascia. So when we're putting too much pressure into the ball of the foot, we're gonna tug and pull harder on that plantar fascia. And we're gonna have pain sometimes in both areas, both on the bottom of the heel and on the back of the heel. So for these patients, what we like to do is we like to really focus in on the calf muscles. The more we stretch out these calf muscles, the longer, the softer these muscles can be, the easier the foot can come up, and the less pressure we're putting both on the Achilles tendon and the plantar fascia. Now, of course, there are other things that can happen back in through here, but persistent pain on the bottom of the heel and in the back of the heel, you might want to start with some stretching exercises. If not, give your local foot and ankle specialist a call, or here in Brighton, give us a call and we'll get you in right away. Because this shouldn't be something that you should have to deal with. We can fix this, we can get rid of this pain and get you back into your sports and activity.